What's up, everybody? Matty Willz checking back in with yet another episode, our fourth episode already of our Wellbeing Wednesday with Matty Willz, myself. Of course, that's brought to you by Metro Health, where every time we have a conversation, we talk to a different representative of Metro Health about very pertinent things that our community needs to hear about. So without further ado, we'll bring in today's guest. Of course, that is Dr. Marsheena Murray, PhD in the title. I don't like to skip those important letters there at the end. And first and foremost, thank you for taking some time out of your day and welcome to Wellbeing Wednesday.
Thanks. I'm so happy to be here. Thanks for having me.
For sure. So, of course, we get you guys' bio, right? And it's always very elaborate, a lot longer than mine will probably ever be. But you've been to a lot of different schools. You got a lot of experience. You want to tell everybody your expertise and how you find yourself working for Metro Health?
Sure. So, like you introduced me, my name is Marsheena Murray, and I'm actually a child clinical psychologist here at Metro Health Medical Center. And I'm also an associate professor at Case School of Medicine, at that along. I have a PhD, so I'm a clinical psychologist, and went to a couple different schools. Just to highlight, I did go to undergrad at Dillard University, so I'm an HBCU alum for anybody out there. And I'm from Louisiana, but I ended up back here in Ohio working at Metro Health, and I moved here to work with the foster care program here at Metro. So we have a medical home for kids in foster care, and I'm the psychologist on a team that helps take care of kids in Cuyahoga custody here. So that's what brought me back.
Dope. Very well versed for what we're talking about today. Also, didn't I see Kent State on as one of your accolades as well?
Yep, that's why I said back, because I'm from Louisiana. Okay. I came to Kent. I went to grad school at Kent State, so I was here for years at Kent State, so familiar with Northeast Ohio. Then went back to Louisiana, and came back here to work with Metro Health.
Dope. I went to Kent State for, I think, 3 semesters, and then they was like, you know what? You're not going to do any work. But that was a long time ago. We don't got to go down there. So all of the accolades that you alluded to and listed off are perfectly married with what our topic is today, which is recognizing pediatric trauma and finding the help children need. So today's episode is about the babies. So, let's just get right into it. Trauma is a word that everybody will hear a lot today as we go through these questions. Can we just first, before we actually get into the first official question, can you just kind of break down what trauma is and maybe the different types of trauma that you might see in your work?
Wow, that's a loaded question. I think everyone has a good general sense of what trauma is, but more specifically, it can mean a lot of different things. So there's a lot of different types of trauma. So a lot of the trauma that I see that kids experience are different types of abuse. So like physical abuse, an adult hitting them or hurting them, sexual abuse. So, being touched inappropriately, neglect. And there's different types of neglect. So it could be like kids who might living in Cleveland in a house in the winter with no heat. Might be considered neglect, or there's even educational neglect, like when kids don't go to school for too long, that becomes neglectful and can lead to them coming in contact with custody. So that's kind of the trauma that I see. There's also other types of trauma. So veterans that go to war experience trauma, seeing things like that. People can experience neighborhood violence, so seeing somebody get shot or killed is a trauma, and experiencing that loss. Even natural disasters, like right now there's a hurricane headed to Florida. And, I lived in New Orleans for a long time, so all those things can also experience can lead to trauma as well. So that's trauma, I guess, in a nutshell.
Got you. Thank you for that. So the term collective trauma is one that we are hearing about more as things like mental health and things of that nature become kind of more like trending topics on social media and whatnot. So can you kind of go over collective trauma? And then there's another term, vicarious trauma, and how those things are impacting our kids today.
Sure. So collective trauma is that are traumas that we experience kind of as a collective, as a whole, something that's happening to kind of everyone, right? So if I get in a car accident, I specifically experience that trauma. But if it's something that multiple people together collectively experienced and witnessed and went through, that's what we kind of consider a collective trauma. And that's different from vicarious trauma. So vicarious trauma is actually pretty interesting because it was actually started out as a job hazard. So not something that everyone would experience, but specific to like an EMT, me as a psychologist, police officers, firefighters, things like that, people who witness like really difficult things. So those things they don't experience them firsthand. They didn't happen to them, but they're there when they happen and they see them happen. And that's kind of how the idea of vicarious trauma has started. So it's really trauma that you see, but doesn't necessarily happen to you. You kind of like witness it. And I think it's taken on a different role because of social media and videos and internet, and it's really kind of grown into something a lot bigger than just, oh, if I have this certain type of job, I might experience vicarious trauma. Now it's more kind of everyone who has a phone or internet, which is pretty much almost everyone, can unfortunately see these things and witness these things.
Yeah, and I'm sure that's opening a whole new world of just opportunities for people to kind of see what kids are going through. Maybe they might need help, or maybe just, have to interject themselves before they even see those really strong signs. So with all of that said, it's funny, all of these videos go back to social media in some form or fashion. It's just the world that we live in now. But with that being said, as a teacher, a caregiver, or even a parent, what are some of the red flags that we all can look out for when it comes to our adolescents, just to make sure that they're good?
So I would say the biggest red flag that I want any adult dealing with kids or around kids to look out for would be changes, right? So if a child is moving one way and then all of a sudden how they act and how they are behaving is different, that's kind of a red flag. Maybe not necessarily one change in one area, but if you see multiple different changes. So as far as like areas, you're thinking about, like, say my child's very social and always out and spending time with friends, right? And all of a sudden they just are in their room and they're not going anywhere, right? That's like a big change. So it could be like how they interact. It could be their grades, or like, say my child's a straight A student, right? Of course. Or even say they not, but say they a C student and then they become an F student. Like, that's a change. Like that drop in grades would be things for to look out for. Changes in interests. So like, what if they're interested in something like really, they love basketball, and all of a sudden they just don't even want to play. They don't care anymore. They don't want to do those things like they used to do. So change is like the biggest red flag. And also I would also want to point out, like, people don't always think about it, but also looking at the child, if you're a caregiver, looking at how they're sleeping and how they're eating, because those things can be the first things to change when people are having emotional difficulties.
Right. So basically, and I don't want to oversimplify this, but pay attention, like just recognize the things that should be I say should be red flags, but I know as a parent in 2022, we all work multiple jobs and long, crazy hours and things of that nature. So it may be a little bit more difficult, but I definitely get the gist of what you're saying. Pay attention to what your kids are doing, or the kids that you are responsible for are doing. So we're talking about kids, we're talking about adolescents today. Is there a major difference in the way, behavioral health is assessed and recognized between adults and children?
Yeah, I think it's a pretty big difference. So it's kind of like the idea of, is an adult and a kid the same? Like how I was when I was a kid versus how I am now, completely different. And so as you're different as a person as you age, your healthcare, and especially your behavioral healthcare, will be different. And so, like for me, for example, I'm a child clinical psychologist. So I got really specifically trained about child development and how kids are supposed to develop as they age, and norms and all of those things, to be able to do this job. And so it's pretty different. So especially like as far as like the problems that you face, right? So for a kid, like peers, adolescents, their peers are like super important. Knowing what to highlight and what to look for can be really different. So the healthcare is different, just really taking into consideration kids and their development and how they develop along the way. One thing I do want to highlight is one of the biggest differences between kids' behavioral health care and adult behavioral health care, and I'm just saying this for your listeners, is that your child needs you to be able to go get behavioral health care help. So in order for a child to go access these services and get the help that they need, their their caregiver or parent has to help, right? If I'm an adult and I want services, I can just go get them. Unfortunately, kids don't have that capability in the same way. And so as a parent, like we talked about, if you see those red flags, you see those changes, you see those differences, take your kid to talk to somebody, see what's going on. They can't go on their own. They need you to really help them with that. And I think that's one really important difference that I really wanted to highlight, because parents, they need you. Because I had a lot of patients that come to me and the parents or the kid might be like, I've been asking to talk to somebody. These past few years, who doesn't need to talk to somebody? I mean, I feel like it's so much going on for everybody. Talking to somebody is what people need. And so sometimes kids ask. So if your child's asking about it, take the time to look into it and try to get them the help.
It's a really good point. As I got a bunch of kids and I got teenage boys and they're getting older, and I'm kind of balancing how much more to put on them, but also still recognizing that they're still not grown-ups. So they still need to be pushed and pulled in some direction. So that's a great point that, in order for them to seek the help that they need, they do need an adult. So thank you for bringing that up. So along those same lines, you mentioned how important children's friends are and their peer groups and whatnot. And sometimes, as we all know, as we've all been teenagers at one point or another, that there could be, it's easy to be made fun of, right? So how do we reduce the stigma as the adults in the situations, whether it's the parent, the caregiver, the teacher, whatever, the stigma associated with just, protecting the mental well-being of our young adults and young children?
I think the first step is to talk about it openly as a parent, as a caregiver, as someone that's around kids. Talk about like mental health in general. I think, the past few years have been like so much for everyone, and it's been a lot of negative, like with COVID, and I call it, all the racial stuff that's been going on as well. All those things are really, really negative, right? But one positive I felt that come out of it is that we were having more of these conversations. So talking about these things, bringing them up, having kind of an open door. Because in the Black community, we always got to be strong, right? That's one of the ideas that's really stopped hurting us and stopping us from being able to get the help that we need, right? So not feeling like we always have to be strong. I think, in the past few years, we've finally been able to say, I'm tired, I'm exhausted, I need help. And those things are okay, and it's just been for so long, it wasn't necessarily okay, or we didn't feel there was a safe space for us to say those things. So I think talking about it would be one of the first steps. And I think also, if I had to say the next thing, it would be kind of shifting our mindset a little bit, because I think that people think about therapy like, oh, you go to therapy, something is wrong with you, right? And that's like not true at all. That's like, like a myth that like really perpetuates the stigma of mental health. And so I think it's just the idea that who can't use a little help. So instead of thinking, oh, you have to have these huge problems and be crazy or anything like that to get mental health, really the idea that who couldn't use another person to help them figure out all this stuff that's going on, or things that they're thinking about and things that they're doing and how they're feeling. Like, we all could benefit from that. And so I think shifting it from what's wrong with you mindset to a how can you be better mindset.
That's a really great response. Again, I'm just thinking about this as a parent. We have the power to take the fear out of these things for our kids, right? Like, we have the ability to, by what you exactly just said, talking about it, making it part of the forefront, making it part of the normal everyday conversation, to remove some of that fear out of it. So then when they go off, they don't feel the stigma at all. So great response. I appreciate that. We got one more question for you. The new behavioral health center that's opening in Cleveland Heights. Every time I mention that, I got to say that I am a Cleveland Heights High Tiger. I won't tell you what year. It was a little while ago, but it is opening in Cleveland Heights, the new behavioral health center. What's that?
Confess the year. Go ahead.
2001. It is what it is. I've said it on the airwaves here plenty of times.
Me too. I graduated high school 2001. See, it's not that bad.
Oh, what? Not that long ago either.
Though.
Oh, well, it is what it is. But that's crazy. The same year. But so the new behavioral health center that's opening in Cleveland Heights, how do you think it will positively affect the, just the behavioral wellness of our adolescents that do go there?
So this new behavioral health hospital is really a big deal. They have other behavioral health hospitals obviously in Cleveland, but there is a big need for more. So what our behavioral health hospital is going to add for adolescents is inpatient beds whenever kids kind of have these urgent mental health issues that arise. And I can say currently they have trouble finding space whenever. So if your child has an issue and they need to get admitted, there's no beds. It happens all the time. There's no beds. And you have to wait days, weeks, or whatever period of time before you can get your child in. And it's really a burden on the community. And so I think adding these additional beds will increase services and decrease the wait times for kids to get the help that they really, really need. Because whenever that happens, it's an acute thing. It's like a right now thing that they need to be there, and to not have beds available is really bad. And I think that increasing this capacity will really make a difference in the community. And it really also really relates, and it kind of can be interrelated to, I know we talked a lot about trauma, and that's kind of my thing, and I kind of see things through that lens. But, whenever kids get admitted and have these acute issues, a lot of times they have significant trauma histories. It can be trauma related. And so, I'm really excited about this new hospital opening up. I think it's going to be great for the adult and for the pediatric community.
For sure. And we're excited about it as well. We'll definitely be out there. I think we'll be out there next week. And we'll do some filming and kind of dive into some of the specifics about the center a little bit more. So I'm definitely looking forward to that as well. But again, Dr. Marsheena Murray with Metro Health, thank you. This was a perfect interview. All of you guys have been great. You're so knowledgeable. You're very easy to talk to. And I really, really hope that our audience appreciates and holds on to these strong words. So any closing remarks from you? You were great.
No, thanks for having me. I love to speak to your audience. That's exactly who I want to talk to. And so anytime you have any questions, give me a call. I want to help and be able to talk to your audience.
Dope. So we'll be, I'm not sure how we do on the interviews, but we're going to keep this thing going. So if we can have you back on, we definitely will. And then we'll meet the whole staff soon when we're out at the hospital. So that was another episode of Wellbeing Wednesday with Matty Willz. Thank you to our guest, Dr. Marsheena Murray, and we'll see y'all next time.